Aiden Chrisostomos turns 2 this June, but he's already begun a fight for his life. His enemy is cystic fibrosis. Aiden's allies in this battle are parents Rachel and Michael, who hadn't even heard of cystic fibrosis until their only child was diagnosed at just 5 weeks of age. What's it like having a child with cystic fibrosis?
Hard work. A lot of work, a lot of patience. Learning things you never thought you'd learn ever in your life. Becoming pharmacists. Stocking our cupboards full of drugs and, becoming total OCD clean freaks.
I'm a very famous race car.
Can you hold it for Mum? Up.
And they're not exaggerating. In addition to 4 of these antibiotic treatments the toddler sits through, today alone, Aiden will take 30 different types of medication, all in the hope of extending his life further down the track. Cystic fibrosis, sometimes called CF, is the most common genetic disease amongst Australian children. But what is it?
They're easy to measure outcomes.
Dr. John Morton is the Chief of Cystic Fibrosis at Sydney Children's Hospital.
It's a disease where there's a genetic abnormality in the way a certain protein in the body is formed. And that protein is responsible for the passage of water in and out of cells. So if that doesn't work, you get abnormal passage of water into your lungs and into your digestive system. And the other thing is that they tend to get, because they've got thick mucus in their chests, they tend to get infection, which then becomes chronic and causes damage to the lungs progressively over about a 10 or 20 year period. You get progressive lung damage.
From deep down.
From your boots.
Yeah, one more big one.
For Aiden, this means a life revolving around hospitals, physiotherapy and medication. Already, his short life has been spent fighting the Pseudomonas bug, which he picked up when he was only 8 months old.
It comes in and out of a healthy individual all the time and it doesn't affect us. So the bugs that affect them are the bugs that are around everywhere in the environment, like even dust.
The bug resulted in Aiden's first hospital admission. It did not go as planned.
There was a complication with his IV line and he got a blood clot in his arm. So it swelled up and he had to go back in and all his veins were no good, so they had to put it in his jugular.
It's getting stronger. It's all right, that. I know.
Words just can't express what you see when you see him going through his treatment. Like, you just got to see it.
My earliest memory as a kid was being tied up in a sheet and being held down by nurses, yelling and screaming while they were trying to get a needle into my arm, like inserted into my vein for IV antibiotics.
19-year-old Rebecca Sterjovski knows too well the trauma of living with cystic fibrosis.
It's just the disease is so unforgiving that it'll just take every cell in your body and, that's why I always say that CFs are born fighters, because if you don't have fight, then this disease is going to kill you and it's going to kill you quickly.
Rebecca was told she had a year to live when doctors put her on the wait list for a double lung transplant.
Lung transplantation is a very people can do very well or they can do quite poorly. Yeah. We've had about 89, since 1992, 89 of our patients with cystic fibrosis have had transplants from this centre. In saying that, we have referred 110. Their respiratory status is failing, and that's why they're waiting, and sometimes their wait is just too great and there's nothing we can do.
Carmel Moriaty is in charge of case management for cystic fibrosis patients at Royal Prince Alfred Hospital. She has seen firsthand the magic a successful transplant can bring, but also the tragedy of missing out.
2 of my 5 children, my 2 daughters, had CF. One died when she was 10 and another died when she was 19. And my 19-year-old daughter's direction to me was that I would go out and fight the fight. Every day I feel as if I'm doing what she wanted me to do, and I feel as if I'm successfully doing what she wanted to do and helping other people with CF, like she and her sister.
In his 40-year career, Dr. John Morton has seen astonishing progress in the treatment of this disease.
And it's changed dramatically. You know, it's a very, very different disease. Because we understand more about it now, but we didn't even know what the gene was, 40 years ago. Well, it's only been 20 years since we've known about the gene. So it's sort of, since the gene has been seen, people have worked out what it does, how it causes disease, how you stop that sort of thing. So it's really very different. We just used to put them in hospital and they were all dying by teenage years, usually. And so 30 years ago, this was the survival. So half the kids had died by 17, and now there's almost no deterioration. And they reckon that if you were born today, you'd live until 55 or 60 with CF without any without curative treatment. So it's getting better and better and better and better.
17 years ago, the outlook for parents with newborn CFs was grim.
When Aaron was born and they took us in for the week of training, they told us that, he's not likely to live past 8 or 9 or 10. And if he did, that most of them die by their teenage years.
But at his last checkup, Aaron Wood was told his lung function was 107%, something that is almost unheard of in adolescent cystic fibrosis sufferers. His success is partly due to his unwavering commitment to his respiratory fitness.
It's because I train. It's only because I train. I still have to take medication, so it's not all sunshine and rainbows.
Every 4 days in Australia, a baby is born with cystic fibrosis. But there is little public awareness about the disease.
Until you have a CF kid or a friend or a relative with it, most people are not really very aware of it. Mainly because it's a disease where when you got it, you look normal. You don't look like you're a sick person. So there's not a big awareness of it. No.
What was your initial reaction when you found out Aiden had CF?
I didn't know what it was. Started crying because I thought it was bad, but I didn't know. And then, of course, jumped straight on the internet and read how bad it was and cried some more. What about you?
Yeah, I found out when Rachel and her mum came home from the doctors, and I was sitting at home and they come in and I basically knew something was wrong. They couldn't talk and they were crying, and I just sort of said, what's going on? And
well, we try to make their lives as normal as possible, and so they look normal and they function normally. And so people are generally not aware of the difference. There's a difference between a CF kid and an average kid. They're all in normal schools, they're intellectually normal, they have every other thing normal, and they look fine, And this is the reason, of course, that we can't get a lot of funding, because they look too good.
The lack of government funding has always been an issue amongst the CF community. Between 2000 and 2011, just over $19 million was spent on cystic fibrosis research funding.
Hypertonic saline, 3%, 7%, 12%.
However, as life expectancy grows, so does the cost of treating patients.
So this is just one of his nebulizer treatments. It's an antibiotic, and luckily it's on the PBS, so it only costs us like $5.80 for a month's supply, when it normally would be about a bit over $2,000. If the PBS wasn't around and all their life-saving medications for Aiden weren't on there, then there's no way we would be able to afford to save his life, really.
It's not easy to calculate the health system cost of a particular disease, but a group of Australian academics have managed to do so, revealing in a recent study the annual health system cost for the 3,000 cystic fibrosis sufferers in Australia is in the vicinity of $67 million. Of course, as remarkable as advances in treatment have been, ultimately the holy grail for cystic fibrosis sufferers and professionals would be a cure.
Australia now, so there are big trials of other drugs in Australia using those outcome measures that should be quite interesting.
There are probably about 10 common types of cystic fibrosis. Some are worse than others. The lesser forms of cystic fibrosis can now be cured, but the more common form, the more serious form, are still working on that, but that's going to be coming within the next year or two.
Kaleidoco is designed to keep CFTR protein channels at the cell surface open longer to improve the transport of salt and water across the cell membrane.
Realistically, it will be years before the US-based drug will benefit Australian patients. Nonetheless, Dr. Morton remains hopeful, and that hope is starting to pay off.
See, everything we've got at the moment is just supportive treatment to slow it down, to slow the progression down. But this is a proper treatment that actually reverts the protein that is abnormal to normal functioning again. And so this is the first real curative treatment for cystic fibrosis.
As the cystic fibrosis community is abuzz with rumours of a cure, Carmel is concerned her patients have unrealistic expectations.
There has been some trials done here in Australia, and some people are getting it now under compassionate access because they did the trials. Just a few, but we have got to a stage where there's a great deal of hype out there, and it's really sort of becoming quite difficult to manage.
It is unlikely the drug, which costs $300,000 per patient per year, will be readily subsidised. For now, a transplant is the only practical solution once preventative treatment stops working.
But it's a very heavy program. It takes a lot of time every day and a lot of medication to keep these kids from deteriorating.
It's all right, mate. Every day. You know what we've got to do? Sit on your chair, on here.
A cystic fibrosis sufferer's treatment program is unrelenting. It's a program that begins at birth.
So we wake up on average 6 o'clock in the morning, give him his first morning antibiotic, then he has his Pulmozyme mask, then he has crayons with his milk, and then he has the special formula, which is extra fats and vitamins. Then he has a low-sec tablet, which helps his acid in his stomach and helps him better absorb the crayon, so he'll better absorb fat. Then he has his physio an hour after he eats. Then after his physio, he has his antibiotic nebulizer mask, and then it's nearly lunchtime. So we have some, morning tea, early lunch. We can play for a little while. Then I have to sterilise and wash everything and soak it and clean it. And then he normally has a sleep at 1:30 for an hour and a half, 2 hours, sometimes more, which is nice because I can sit down and relax or, do what I want to do. Then when he wakes up, we normally have a bath, get ready for dinner.
And then what you just saw then, the treatment that you just went through.
Yeah, then dinner, and then it's time for bed.
The reality is, without dramatic drug intervention, cystic fibrosis will take over the body. Lungs undergo significant damage from infection caused by a thick mucus blocking air passages. The same mucus clogs the digestive system, making it near to impossible for the pancreas to excrete food-digesting enzymes. The kidneys, liver, and sinuses are all affected. 98% of men with cystic fibrosis are infertile. This is not a disease that can be tackled alone.
Lung transplantation has come in. That buys them some time and gives them a lot better quality of life. It's not a cure, but it is there for them.
A transplant is still the best case scenario for cystic fibrosis sufferers, as Rebecca knows.
Can I just take you back to the 6 months leading up to your transplant? What was life like then?
Horrible. Life was very difficult. I was unable to walk very far at this stage, so I'd walk about 20 metres and it would feel like running a marathon, and I would have a cough attack and just cough for about 1 or 2 minutes straight, and it'd just take the life out of me. It was always quite frustrating dealing with the fact that your body is just betraying you every single second of the day. Couldn't even shower. Like, my sisters would find me multiple times on the bathroom floor, just exhausted.
Then one winter's night, Rebecca received a phone call that would forever change the course of her life.
I was just shocked and couldn't believe what was going on. I mean, the car ride there was the longest car ride of my life, because there's always a chance that the operation won't go ahead due to whatever reason. There might be something wrong with the lungs, and then they wheeled me in, and that's the last thing I remember.
When you woke up from your transplant, how did you feel?
I could tell the difference in my breathing, like almost immediately. Even though I had the breathing tube still down my throat, I could just tell that there was a difference. I was just elated, like a ton of bricks had been lifted from me and all this weight had been taken off my shoulders. And I mean, I can't remember much. I was still quite drowsy, but my family tells me I started crying. It was the first time I'd ever been able to breathe properly. And I mean, everybody takes this for granted, you know, you breathe all the time. But for me, it was the most amazing feeling.
A transplant is not in the near future for Aaron, but life with cystic fibrosis is still not without sacrifice.
It's hard when you look at other people. You know, they get their life so easy and you hear them complain, and it makes me angry. You sit and watch TV and you see all these people climb mountains, travel the world, go to Egypt. Yeah, I can't do that. It's pretty much impossible. I'd love to do it, but I can't. A lot of my friends, they could spend a whole year without getting a sick day, and I'll spend about 52 days sick.
I'm very aware of the difference in lifestyle between a young adult with cystic fibrosis and a young adult who doesn't have cystic fibrosis. The young adult with cystic fibrosis certainly does have a lot to experience, and they really have a lot to do every day before they even start to act like a normal person.
Day-to-day life is a struggle against cystic fibrosis for the Chrisostomoses, who have gone to extraordinary lengths to ensure Aiden has a fighting chance. Rachel and Michael spent 5 months fundraising $15,000 to purchase Aiden the breakthrough physiotherapy vest.
We really like the vest because he doesn't fall asleep and he's active while he's having it. And we like actively coughing and staying awake. When we used to do the manual percussion, he'd fall asleep. And the doctors all said that that was not good and we need to try and keep him awake because they breathe differently while they're asleep. And he's not actually moving any mucus at all. So we're pounding away for half an hour in all different positions and he's asleep and it's doing half the job.
In a life that is surrounded by sickness, it's hard to remember there's more to it than just medicine.
It's a huge stress on a family to have this, you know. I mean, it's changed, the whole function and dynamics of the family change to looking after the person with the cystic fibrosis. So siblings sort of feel they've missed out on things. Parents feel guilty because they've given this disease to their kids, you know, this sort of thing. Family breakup is very common, you know, because of the stress of chronic illness and all the demands that it places on the family, you know.
So my younger sister would always, you know, make sure I had food to eat. She would make me lunch when she came home from school, and she took on more of a parental role, and a 16-year-old shouldn't have to worry about the things that she was worrying about.
There is a way to eliminate the disease and all the problems associated with it altogether, but it brings its own dilemmas.
Well, I think prevention is the ideal for any disease, you know. Curative treatment, well, you know, we don't know enough about it yet to know whether it's a permanent cure, you know, or do you develop side effects from it, or a whole lot of things.
Currently, all newborn Australian babies are screened for cystic fibrosis, but there's an argument over introducing mandatory carrier or prenatal screening, which may stamp out the disease altogether.
They've looked at that in the past and thought it's not economically kind of viable, and there are ethical issues and a whole lot of things.
Although Carmel believes it is impractical to screen every person in the country, she is involved in a program bringing prevention closer. Genetic testing for family members and partners of patients.
Where we are doing our part is that people in relationships, we proactively offer them genetic testing when we see people in a serious relationship.
The extremely successful program has seen some couples go ahead with pregnancy despite a 1 in 4 chance their child will have cystic fibrosis. After Aiden was born, Rachel and Michael underwent similar tests.
So don't worry about that. Yeah.
Michael's got a sister and a brother that haven't had children. So it's more for their benefit to find out where it's coming from so that they don't have to go through what we've been through.
The young couple have decided to change future plans because the risk of cystic fibrosis reoccurring is too high.
We wanted to have more children.
As you said, there's a 1 in 4 chance.
Yeah, I don't want to take that chance.
I mean, we wouldn't take anything back, don't get us wrong,
Yeah,
with Aiden, but
absolutely
I mean,
not.
Yeah, now you know all about it and we've been through it, it's a big decision.
Massive.
You know? So, yeah.
And it's heartbreaking to think that, you know, you'd bring a child into the world knowing that they could suffer that. I don't want to do that.
1 in 25 people are carriers of the gene, meaning statistically right now in Australia there are almost 900,000 people carrying the cystic fibrosis gene, and only a fraction of them know it.
If you could describe cystic fibrosis in one word, what word would you use?
Unpredictable.
Painful.
Challenging.
Hopeful.
Unfair.
Rachel?
It's just horrible.
Aiden will continue his daily battle against cystic fibrosis for the rest of his life. At least for now, he doesn't realise he's doing anything out of the ordinary.